Okay, so I've started recording now. I've got some letters. I don't know from whom. I didn't compile them. So if yours is not included, it's not included. Nothing to do with me. So let's do a screen share. Let's have a look and see what we can see. Okay, let me just put the chat box here. So if anybody's got any questions, I can see it, and I'll manage participants. You raise your hand, I'll turn your mic on. Okay, so apparently some people had a spot of trouble with this one. I don't know why. So first things first, we go straight to the task as always. GP, write a referral letter to the consultant obstetrician. Okay, so that's what we're doing first. Okay, let's have a look. Refer Jane and Childers. Yeah, that's who we're writing to. Okay. Commence folic acid, arrange blood tests. So quite a few things we've got to do here in this plan. Okay, so let's have a quick look at the history. Pre-eclampsia, caesarean, baby Sam. Okay, we don't really need that. Normal baby, okay. Medical problem, pregnancy. Antenatal, severe eclampsia. So, okay. Relatively straightforward, right? Let's have a look, see what we've got. So, let me just check the word count. See what we've got here. 246. Looks a little bit long. Who's this? That's Ahmed. I'm writing to request antenatal consultation after birth care of Mrs MacIntyre, 8 weeks pregnant, with the patient with obstetric history and high risk factors. Okay, well, that seems relatively straightforward. I'm writing to request. It's clear what you want right from the start. Reference, requests. Okay, seems pretty straightforward. In term, okay, right now, in terms should be plural. Mr. What's this? Mrs. Had. So we've got 3 mistakes in the first sentence of paragraph 2. That's not looking good. Severe preeclampsia crisis, the first pregnancy which resulted in an emergency caesarean section. Furthermore, she had 2 previous miscarriages. She had had. Okay, now, right. Present perfect, okay. So, past perfect, you're going farther back. Okay. So, she had a severe preeclampsia in her first pregnancy. If she had 2 previous miscarriages, right, it's got to go farther back. So here it's simple past, have had, she had, a possessive. So here we've got to make it had. Now, I know it's a bit confusing when you're using past perfect and possessive past form of have, had, but these previous miscarriages are farther back, so it's got to be past perfect, yeah? She had. I know it sounds a little bit strange, but because had and these were farther back, had 2 previous miscarriages. Second pregnancy and delivery were normal. Okay. Now, second pregnancy and delivery, strictly speaking, it should be was, because it's a singular event. I mean, there's like 2 events, but they're kind of connected. So, okay. You could use was referring to both, right? On presentation today, Mrs. Now, something else, right? You don't need this full stop, right? Don't use it. Now, you haven't put whatsoever. There's no full stop here, no full stop here, no full stop here. Don't use it. You only put your full stop if it's an abbreviation such as prof for professor, or capt for a captain, or something, you know, or adm for an admiral, or something such as that, right? So if it's not an abbreviation, you don't need a period. Okay, so don't use it. Reported that she is heterozygous factor V line, has a family history of thrombosis, which was treated with pregnancy. That's one sentence. That's far too long. Far too long. That's a single sentence. In some letters, that's almost a paragraph. Family history of thrombosis. Do we need that? Thrombosis, is that important? Kind of relevant? Thrombosis. So I prescribed. So anyway, I don't know if we need that, but there's too much there. That's far too long and complicated, the sentence. In addition, she complained of difficulty in urinating, not urination, urinating. She had problems urinating, a verb, not urination, a noun. Make it a verb. For the previous 3 days, I would write 3 as a word. And the urine dipstick test showed the presence of a large amount of protein nitrate along with slight blood. View of urinary tract infection. Okay. Now, according to what I've been told, the urinary tract infection is a secondary issue. It's not the most important one. Eclampsia is the most important issue. The urinary tract infection is secondary. Yeah. So pre-eclampsia. Right. So the urinary tract infection, so pre-eclampsia, okay. Caesarean, I don't know if we need a family history. Thrombosis, okay. Do we need to know how it was treated? Maybe not. Okay, see what else we've got. Painful urination, again, it's secondary issue. Referral induced for history of severe pre-eclampsia, caesarean section, and her age. So this is the important stuff. This is the main issue. Severe pre-eclampsia, she said previous caesarean, and her age, because she is 38, I think now, is it 38? Yeah. So age is a factor, miscarriages, so that's the important stuff. So obstetric history, high risk factors, okay, that's good. View of urinary tract infection, okay, examination normal, okay. Measure of coiling with counselling, antenatal screening. Now, you can't counsel someone off antenatal. You can counsel them and give them a screening, but you can't really counsel someone on or of antenatal screening. I mean, you know, what can you say? It's a procedure. It's just a screening. It's not sufficiently traumatic to require a counselling. So I'd be careful there. Okay, so not too bad. That sentence is a little bit long. Let's say urine stuff, urinary tract, that's not really the main, but okay, in general terms, that's not so bad. But just watch, you know, that Mr., Mrs., has, past perfect, had, okay? And make that a verb, not a noun, okay? Urinating instead of urination, all right? Okay, let's have a look. How many words have we got here? To 18, okay. Suggested, okay. Is that the main issue, right? Does the obstetrician need that first? I thought the high risk of a pregnancy was the most important issue. Is that not so? The, you know, severe pre-eclampsia, etc., age, high risk factors, isn't that what we should have first instead of, oh, she's got a UTI? So I don't know if that should be right at the start. You know, I don't think so. High risk, that should be at the start. All right. Refer Mrs MacIntyre to you because she's at high risk, eclampsia, caesarean age, etc., etc. Right? You can mention the UTI later, put it farther down here. You don't need it right in the introduction. Okay. Your care will be appreciated, or your care would be appreciated. You don't need that sentence. Don't need it. You're not begging a favor. The obstetrician will see her in any case. It's her job. It's what she does. You don't have to, oh, please, will you see her? Oh, appreciated. Well, maybe it will be, but you don't have to put that in the introduction. All you need to do is simply tell whoever you're writing to what you want them to do, and that's it. Okay. Mrs MacIntyre, that's not spelled right. Pregnant for 5th time, she had 2 previous births and 2 miscarriage. 2 miscarriage, how many miscarriages? Okay, I don't know if you should just drop that sentence in right at the start, you know. You could mention the first pregnancy. So I would have started from the start, you know, the first pregnancy. Okay, she was pre-eclamptic, caesarean, blah, 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 blah. And then you could have included that afterwards. Yeah. If you look at the previous one here, right? So in terms of the past medical history, okay, the first event is mentioned first, blah, blah, blah. And she also had 2 miscarriages before. However, the second was a normal. So that makes a bit more sense than putting that there and then mixing it up. That preterm labor had occurred and the baby required intensive care and respiratory support. Well, yeah, but possibly, but do we need that? We don't really need that information, do we? The important thing is the first pregnancy, pre-eclampsia, caesarean, okay. The second one was normal. You can mention she had 2 miscarriages between, you know, before the first successful event. So if you're trying to establish a chronology, you know, it has to make sense. You don't want to be, she's pregnant now, she had 2 previous births, and then her first pregnancy. You know, it's like you're jumping back and forth, back and forth. Do it like this previous one, right? Show and order. So she had severe eclampsia, first pregnancy. She had miscarriages, okay. Second one was normal, good. But here, it's not really logical. It's not presented in a logical way. So, and I don't know if this is really important, if we need that. Okay, from a social history, family history of thrombosis. Do we need that at all? I don't really know. Maybe not. Pregnancy test was positive on special period, and she went to my clinic. So right, this is not very clear what is going on here. In? What do you mean on? It isn't in, it's on. If it's a date, it's always on. On the 21st, on Tuesday, on the 22nd, on Wednesday, it's always on if it's a date. Pregnancy test was positive. her last menstrual period was when she presented. So we need something here. Either end that sentence, start a new sentence. I'm not clear what is going on here. Is this when she presented, or did she present at a different date? No idea what is going on here. No idea what that paragraph, what the sequence of events are. I'm sorry, not clear to me at all. So that's not so good. Needs a bit of work there. In view of the above, antenatal care is so highly recommend. You mean highly recommended? But you wouldn't say that. It's so highly required. So that's not a very good phrase. Not a very good phrase. We won't use that. You could say your antenatal care is requested, but is so highly recommended. For scanning for possibility of Down syndrome according to her age and starting of folic acid. So this needs a lot of work, right? In terms of logic, in terms of structure. The material needs to be organized in a much more logical way. Now, I was talking to another doctor yesterday, and I'll say the same here. You are telling a story, right? You are presenting a narrative, essentially. The first thing is, okay, doc, I want you to do this, 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 this. I want you to assess, take charge of, do, whatever you want the person you're writing to do. You tell them that first. Then you're presenting a narrative, a story, a logically laid out series or sequence of events that leads to the current request. Okay, so logic, you need a chronology. How does this lead up to what you are asking them? So it's a bit disjointed. You've got information that we don't need, some stuff I'm not clear what the timeline is. So this needs a bit of work. Okay, why is this bold? It's a bit painful, bold. So let's make it, no, well, no. I'll leave it. Okay. I'm writing to refer this woman, this pregnant woman. I would always put the name Miss MacIntyre. If I spelled that right, MacIntyre. Who needs antenatal care regarding her history. Now, we wouldn't say regarding here. Writing to refer Mrs MacIntyre, who needs antenatal care because of her history of etc. You don't really need or a bit more formal. Due to is better. Due to her history of severe pre-eclampsia, caesarean section, and her age. Okay, now you notice here there's no mention of the UTI because it's not a major issue, a secondary issue. The major thing is, she is 38, she's had eclampsia and problems in the past, so therefore she needs assistance. Okay, in terms of medical history, now first pregnancy, we need a verb, was, but it wasn't terminated. A termination is like an abortion. It's when it's finished. I mean, I suppose you, in strict terms, in English terms, you you could say her pregnancy was terminated because she gave birth, but a termination usually means when something ends, end of life. It's like an abortion. So I wouldn't use terminated. She gave Mrs MacIntyre's first pregnancy by means of an emergency, a caesarean. So it's not a it wasn't a miscarriage, was it? The baby was born, but by caesarean. First pregnancy was delivered. I think that's possibly a better way, by means of an emergency, because the baby is alive. It came out live. It's still around, so a delivery by means of caesarean. Subsequently, she was hospitalized in intensive care unit in the ICU. Well, okay. Second pregnancy was uneventful, and the baby was delivered at full term. Of note, she has a history of 2 abortions since now, 2 miscarriage. Now, is it since? Yeah, 2. Let me just check these like notes because I don't know. Hang on. So, first pregnancy, second pregnancy, 2 miscarriages. Okay, so they came first before. Okay, yeah, I thought so. So it's not since. It's not since. She had 2 miscarriages before her first successful pregnancy. Yeah, so it's not since. Yeah, so it's previously. She has a history of 2 miscarriages or prior. Okay, so it's not since. And I don't know if we need the thrombosis, if we should really note that or not. Not sure. So you've got to be careful about how you spell this. Sorry, spelling. I mean, you have to be careful about how you lay out the sequence of events. Okay. Today, she presented to me with a positive home pregnancy test, complaining of painful urination for previous 3 days. Revealed infection despite enormous damage. Was commenced. Need your further care, high risk pregnancy, previously take. That's good. If you could take over this case, that's a good expression. Okay, so that's not too bad, not too bad. You just got to watch how you sequence the events. Oh, 10 minutes left. Turn that off. You've got to sequence the events. So the miscarriages occurred first, not afterwards. So it's not since, it's prior to. Okay, so not too bad, not too bad. Mrs MacIntyre, 39 years old. Okay. You can put the age, but really, we can see it here from the date of birth, so you don't really need it, Mrs MacIntyre needs antenatal care and birth for her 5th pregnancy with history of, what, with a history of, why is there a gap? Severe pre-eclampsia, caesarean section, and her age. Your vagal assessment would be highly appreciated. Okay, but you don't really need that. I mentioned this to somebody yesterday in a session on Sunday. You don't need all these, right? We were looking at some letters on Sunday, and the first 4 had virtually the same introduction, nearly word for word, using these memorized and copied expressions. We don't need it. You're not going to get a good grade if you are not original, if you simply memorize a phrase. So Mrs MacIntyre has 2 children and 2 histories of, well, 2 miscarriages. And what's this? And Miss MacIntyre has 2 children, don't need that, 2 miscarriages, and a family history of thrombosis. The first pregnancy ended with an, because it's in the E, with an emergency cesarean section, 32 weeks. She developed severe. Now, what's the difference between severe and sever? To sever means to cut something off. Severe means intense. You know, so make sure that you use the right word. Severe pre-eclampsia, second pregnancy level. It's both pre, although what? We don't need that. Why do you use this? You use phrases or words like although, despite the fact, in spite of, to indicate some kind of a contrast. But what are you contrasting? So you wouldn't use although. You mean and, also, as well as, but not although, because there's no contrast there. Okay. Mrs MacIntyre came with A. Don't forget, watch your articles. Positive home pregnancy test. And she's about 8 gestational weeks. Additionally, she suspected 2. Well, you can't suspect 2. She suspected that she has, but not suspected 2. She suspected that she has a urinary tract infection based on her symptoms and the urine dipstick result. Ms MacIntyre was prescribed folic acid for 4 weeks pregnancy. I will spell it out. The above, I am refer. It's either, right, so if it's present simple, I refer. If it's present continuous, I am referring. Okay. For antenatal care and birth, should there be any queries, candidate hesitate to contact me. So there's a lot of mistakes here. You can see lots of grammar mistakes here. Articles, plural, articles, misspelling words, misuse of discourse markers, relative pronoun that. So a bit of attention needed for grammar there. Right, 5 minutes left. I'll probably just have time to do this one. So, writing to this patient antenatal consultation. Okay, so antenatal consultation with regard to the possibility of developing high risk. Well, the pregnancy is high risk, so I don't know if it's going to develop high risk. It already seems to be quite high risk or risky. When I like to refer this patient, I would always put, you know, a name. MacIntyre. With regards to a possible height, right, with regards to the possibility of high-risk pregnancy. Okay. In terms of past medical history, or in terms of her past medical history, her first pregnancy led to a preterm labour due to preeclampsia, which was terminated by by an emergency caesarean section. Consequently, she was commenced on magnesium sulfate and hospitalized intensive care unit. Okay, as you would expect. Her second pregnancy level on babies with the full term. She has 2 miscarriages, has had 2 miscarriages, present perfect. The positive, because you don't say when, has had present perfect. With a positive family history of thrombosis. Okay, now that's not bad, okay? Relatively clear, just a couple of things. but all the key information's there. Should I present my clinic reporting painful urination? Now, you can use it as a noun there. In the previous one, it should have been a verb, urinating. During the previous 3 days, was a positive for pregnancy test, despite no observations. Despite? Her urine dipstick reveal protein urine infection was respectively. Needs a specialist consultation. You only use an if it's a vowel or a vowel sound. An apple, an orange, an emergency. A specialist. Okay, appreciated. Okay, appropriate. Okay, it's not so bad. Not so bad. Not bad at all. 224. Okay, so just one or two things there. Present perfect, incorrect use of past tense there. Lead, led. Actually, lead, led. I have led, yeah. Led, L-E-D, lead, led. Led to preterm labor, delivered, has had, present perfect, article. Okay, and a instead of an because it's not a vowel sound, it's a consonant. Okay. Don't have time for that last one. This will finish in a minute. So, very good. What I'll do, I'm going to put the file in Easy Class so you can access that. And I'll put this video on YouTube and I'll post a link to it in the group. So if anybody's got any questions, because this will end in a second, I'll be on Telegram for the next 10 minutes or so. So I'll see you soon. Bye for now.